Hello, hello, hello. Nanakulema here, and as always, I'm here to help you find your authentic self. It's July, which means it's Fibroid Awareness Month, and from the 1st to the 31st of July, I'm dedicating all my platforms on social media and otherwise to bring much needed information about fibroids and fibroid management. Today, I am joined by Dr. Jacqueline Anita Sowah to talk about symptoms and how to spot fibroids. If you believe you have a suspected case of fibroids, how to actually go around identifying it. So join me in this discussion. Dr. Sowah, I'm so happy you're here.
Same here. And thank you for having me.
Absolutely. Thank you for coming. So it's July, it's Fibroid Awareness Month. And so I'm going to let you talk a little bit about yourself and your personal story, as well as sort of, your career, your professional background, and also your own battle with fibroids.
Okay. So hi, viewers. I'm Dr. Sowah, as she rightly said. I'm actually Ghana, born and bred in Accra. I did my medical school education with the University of Ghana Medical School, now School of Medicine and Dentistry. Okay. I graduated, I'm class of 2010, did my first year house job in Korle-bu, then went on to do the second year at the General Hospital, where I worked in the Department of Obstetrics and Gynaecology, because that's the field I've always wanted and I've always loved. Yeah. To be an OBGYN, because I believe women shouldn't die whilst giving birth. And then also things that have to do with female reproduction or reproductive organs just excites me. So, well, yes. I'm currently doing my residency program in Korle-bu, and I'm in the final year awaiting for my exams. Hopefully Corona will go away and have the exams, but for now, yes, I'm in Korle-bu with the Department of Obs and Gynae. Yes.
Fantastic.
Thank you.
So you have had a personal experience with fibroids?
Yes, I have.
And what was that experience like?
Well, mine was maybe a couple of years back. It has to do with bleeding, because that's what people usually, present with.
We'll get into that.
Exactly. So yes, the bleeding will not stop. So I went to see my doctor and I was investigated, and they realized I had fibroids. And it wasn't that, fortunately was just one and quite big, maybe half of my palm. Okay. Yes, maybe half of that.
So how many inches?
So maybe like 8 by 6, I would say, maybe. Yeah. So I went through processes, and then I had the surgery done, and I'm here today.
You're here today, and we're so happy you're here today. We're going to talk about symptoms, but before we get into symptoms, can we talk a little bit about risk factors? What are the main risk factors to look out for?
Okay. So the risk factors are several. One of such is age. Okay. So usually affects people in their reproductive age, because fibroid is dependent on hormones. Okay. Females, we have the estrogen, we have progesterone. Yeah. So the reproductive age group is a risk factor. It's usually those from probably above 30 years. Even sometimes it can be earlier than the 30-year age group. Yes. And then usually by menopause, it also reduces.
So anywhere usually between your early 20s and maybe your mid 40s.
Exactly.
Okay.
You're at risk. You may be at risk of developing fibroid. Also, early age at menarche. By menarche, I mean your first menstrual period. So the earlier your menarche, the more risk you are to developing fibroids, because that means you have a longer number of years or reproductive years to have effect on fibroid development, because of the hormones. More hormones will be released around that period. So the earlier menarche, higher risk that you may have in developing fibroids. And also black race is also a factor.
African,
exactly. Right. Reasons we don't know, but for some reason it affects more blacks than the white, Caucasian, or Hispanics. And then also, if there's a family history, you also may be at risk of developing as well fibroids.
So you can't know your family history unless you ask. I mean, we all have so many stories of aunties who supposedly just up and died during childbirth.
Yeah.
All we know is that they had a baby and it just kept bleeding, and nobody really tells you
What the
cause of the bleeding was.
Yeah.
I have so many stories in my family history where my mom has sisters and cousins who passed away during childbirth, and there's no real discussion as to what happened.
Well, the bleeding in pregnancy, sorry to, chip that in,
Yeah.
but it could be from several things.
Right.
It could be a cervical tear, it could be the uterus not contracting, or not contracting because of the fibroids, or just not contracting, or there was a tear somewhere that was not recognized.
Right.
But yes, fibroids too, if you have a lot of fibroids in pregnancy, you could also bleed a lot during childbirth.
So it's important to be asked.
Now with a modern technology in terms of investigations, now every pregnant woman will do a series of scans even before the end of the pregnancy. So when you do your early pregnancy scan, you're able to pick up, the scan is able to pick up the fibroids and able to tell the location and
all the prenatal stuff.
Exactly.
But then when I was talking about asking, I was talking more specifically about family history.
Yes. So, family history will pose a risk. It doesn't mean if you have it in your family, you will get fibroids. Okay. Exactly. But family history has been shown to, cause to be a risk factor to developing uterine fibroids.
Yes. We need more research.
Exactly. Yeah. And then also being obese, because obesity too, yes, can because you have more hormones or increased production of hormones. And like I said, fibroids are dependent on those hormones.
It's hormonal.
Exactly.
So it's by finding balance, blood sugar balances, everything balancing, because everything
is connected in the body. So yes, because the more obese you are, the more likelihood that your body is converting what we call androgens, some hormones found in males, which we have small quantity in females too. It's converted to estrogen, and this fibroid depends on the estrogen to grow and all that. So yes, all these things can pose as a risk factor to developing fibroids. But it doesn't, risk factor means you could get fibroid from having these 100%. Things. It doesn't mean that if you have these risk factors, it means you have fibroid at all costs.
So it's not an increase. So it's increased risk. It doesn't
exactly.
It's
doesn't
not a cause.
Mean, no. It doesn't mean you have this fibroid. No, because the fact that you had early menarche or all the things I mentioned, it doesn't mean because you have all these things, it means you by all means develop fibroids. No, not necessarily. But it poses a risk to you developing the fibroid.
I love that you brought it up, because I think part of this conversation we'll talk a little bit about lifestyle and lifestyle changes if we do want to manage fibroids, if we do find out. If you had to quantify fibroid symptoms, what would be sort of the top 3 that if you were experiencing, you would suggest that a woman get investigated?
Okay, so the first and foremost will be heavy menstrual bleeding, because it has a lot of effect on people's quality of life, because they'll take their shower, put in a pad or tampon, and within an hour or 30 minutes, it's just soaked like that. So definitely they'll feel awkward stepping out of the house, because they'll never know when they'll soil themselves. So yes, so bleeding, which heavy bleeding, which we call menarche. Yes, and then also some people will also present with pressure symptoms, depending on the size.
So
pressure symptoms. So by pressure, I mean depending if it's big, it can impinge on your bladder. So it can excite, it can sort of like excite the bladder so you pee more often, or sometimes it may even obstruct probably the neck of the bladder. So you may retain urine, difficulty in peeing, or may also cause incontinence of urine because of the pressure. So it's exerting a lot of force on the bladder, causing the bladder to contract irregularly. And if you're not careful, you may even lose urine without realizing you're losing urine. And then
when I was dealing with fibroids, I realized that when I would need to pee, it would be so aggressive.
Exactly.
Yeah.
Or even the least cough, you may. Okay. Yeah. Also, but that doesn't mean if you have the least cough or anything, it means it's fibroid you have.
Could be other things.
It could be other things. Right. Exactly. But yes, and then also some patients too may present with an infertility. They've been trying to conceive for a while and they are not able to get pregnant. It may be fibroid, but it may also not be fibroid. But sometimes, depending on the location of the fibroid. It may cause you to not be able to conceive.
Right.
Exactly.
So if somebody says, I'm experiencing all three of these together, what is the likelihood?
I'm coming. So, and then also one more, also sometimes pain that may be associated with the fibroid. During menses, some may have severe pain, or maybe during sexual intercourse, they may have some form of pain. So,
I know I asked for 3, but
I
do
know,
we need to expand it to maybe 10?
Maybe less, but yes, I mean, the symptoms are more than the 3, but
okay. So now we have covered 4: heavy menstrual bleeding, pressure problems, infertility,
yes, exactly.
and heavy cramps.
Yeah, the heavy cramps, and then also sexual intercourse may be very painful too.
So pain during sexual intercourse.
And sometimes someone may just experience pain which is not related to her menses. Exactly.
So in random times when you're not even on your period and you
may even feel pain. Yes, I think basically the main symptoms, basically, yes.
Wow. So is somebody, okay, so these are 5, and I think I experienced
with the pressure symptoms, I mean, it could either be related to the urine or related to the bowel. So depending, if it's obstructing the rectum, you may also present with constipation.
Oh, wow.
So it's varied, yes.
It's varied. Yeah. It is varied. I think out of the 5 that we covered, I probably experienced maybe 2 or 3 out of them. Okay. So somebody would say, okay, I have symptoms, or I think I might have symptoms. What next?
Okay. So if you think you might have symptoms, you can just go to any hospital or clinic of your choice and see a doctor, and then tell your doctor what you're feeling. The doctor will investigate you. And then if it is fibroids you have, then yes, if you need to be treated, yes, you'll be treated depending on your option, the options available. And what you opt for.
Okay.
Yes, but sometimes some of the fibroids too may not even present with any symptoms at all.
So that's where I want to get to, because some people might say, I'm asymptomatic. Should I be freaked out? Because there's family history of fibroids, or maybe I'm only experiencing heavy bleeding, but not everything else. I'm relatively asymptomatic. Should I?
No, you shouldn't freak out.
Right.
Because, I mean, being asymptomatic means they discovered you had fibroids based on an incidental finding. Probably you went to the hospital for something else or something. Yeah. And you had, a scan was requested for, and then they realized you had the fibroid. So if it's not really giving you any symptom, anything to worry about, yes, don't freak out.
Right.
Because it's not a death sentence.
Right. Exactly. Because it can be managed. And I think that's the important thing. That's what we really want to cover in this discussion, is that fibroids, as much as they can cause some problems, they actually can be managed. It's not hopeless. So this brings me to the next discussion. I know of some woman who said that, I feel I have symptoms, but my doctor refuses to test me. What would you say to that patient? First of all, come to her.
Okay. So I'm wondering why the doctor will refuse to, investigate or attend to this patient, because sometimes the patient might also probably be symptoms that you may be feeling may not necessarily be fibroids, but the patient might think it's fibroid she has. Yes. So, if you go to any hospital and you tell the doctor you want to be investigated, or you feel you have these symptoms, it should be even the doctor's decision to, prerogative to screen you or have investigations done on you to determine whether it's really the fibroid you have or probably something else, just to put you at peace. Right. Exactly. Because some of these symptoms may also not be fibroids. It may also be something else. Right. And all the same, you have to investigate the patient to be able to determine what exactly is wrong with the patient. If there's really nothing, then probably it's just psychological. Maybe the patient feels like maybe it's a family history. So the moment I feel this, maybe it's fibroid. A lot of patients too will come to you and will think they are having some symptoms, but maybe most of the time it may not be symptoms or may not even be related to the fibroids.
With the prevalence being so high amongst women of African descent, not just on the continent, but actually the diaspora also experiences very similar numbers. Yeah. People do kind of say, okay, well, maybe not. But what would be the number one thing that you want people to know if they are presenting with symptoms?
So like I already said, if you are presenting with symptoms, definitely you have to go to the hospital because, like I said, even the symptoms you may have may not necessarily be from a fibroid origin. It may even be from something even more serious
than
than a
fibroid.
fibroid. So, whatever, listen to your body. Whatever you feel that you think it's not right with your body, yes, you should see a doctor to investigate, maybe a GP, and through that, yeah, maybe after a series of investigations and it's fibroid that is picked up, they can refer you to the gynecologist for treatment. And the treatment will be based on your preferences. So I don't know if you want us to go into treatment now, or maybe we can do later.
Oh, that's for another video.
Okay, then that's fine. So basically, yes, listen to your body. If you feel there's something different, yes. Sometimes some people also present, they may not even feel any of these symptoms I mentioned, but they may feel like there's a mass
Lingering,
moving
yeah.
in their abdomen. Yes, so they'll say, oh, I feel like maybe I can feel the mass in my abdomen, or I feel like something
have
is
that.
moving in my abdomen as well. So yes, it could be fibroid. It may also be something else.
Okay.
So yeah, a lot of disease conditions have similar presentations. That's why when you come, we will ask you a couple of questions and then be able to identify whether this is the cause or that is the cause.
And don't be shy. A lot of us are very shy about talking about our bodies, specifically women. I think there's a lot of stigmatization, as we've already sort of, before we shot this, we had a long, lengthy discussion about stigmatization and how from really a young age, our bodies are almost taboo, even to us, ourselves.
Yeah.
You know, so there is that sort of shyness. And so, yes, talking about it, I believe, has really, it's saving lives.
Yeah.
So let's continue to talk about it.
Okay.
Well, thank you, Dr. Sowah. Really, really appreciate. We talked about fibroid symptoms. And we were going to go over the 5 that we talked about. We said, first of all, heavy bleeding during menstruation,
Pressure symptoms,
incontinence, infertility.
Yes, and then so the pressure symptoms include incontinence and then the constipation, and then the infertility, then the pain, menstrual cramps, this menorrhea, and then pain during sexual intercourse.
And pain during sexual intercourse. All right, you heard it right here. If you like this video, go ahead and like it. If you have further questions, leave a question in the comment section below. And as usual, all the fun goes down on nanakurama.com. Head over there to connect with other people who are interested in the subject, as well as checking in on our fibroid activism page to check out our short, medium, and long-term goals. July is Fibroid Awareness Month, and I've dedicated my entire platform to educate and bring forward very important discussions to help us understand fibroids better. Thank you once again, and Nana Konama.